Hiya, my name is Diana Karamakoska, and in this week's topic we will be covering strategies for cross-cultural communication. When we look at strategies for effective communication, we must be self-aware and commit to understanding the differences between cultures. You must also show a willingness to exposure and learning from that exposure. Do not attribute national or cultural stereotypes to individuals, as this presents a level of judgment and prejudice and discrimination that is not appropriate for the workplace. Treat others as you would like to be treated. Demonstrate empathy in your discussions with the clients or patients, and communicate respect with them. Be open-minded to the alternatives that they present you with that are relevant to their culture. And don't assume information. Always ask the client for clarification to ensure that you receive accurate, representative information of what the client is telling you. When language is a barrier to communication, you can always use an interpreter. All patients have the right to access an interpreter. Interpreters also ensure equal access to knowledge and the quality of services being provided. Health services employ qualified and accredited interpreters who are familiar with health services, the terminology, and also the culture relevant to the individual. They should be used for important or legal matters, such as seeking consent. There are different types of interpreting. The first one is simultaneous, and this is where we have the interpreting occurring at the same time as the original information. This is generally not used when speaking to one person, but rather for a group. For example, Auslan programs allow for this to occur, where an individual is being recorded for what they are saying and you can hear the simultaneous translation through headphones. Another type of interpretation is sequential. This interpreting occurs in small portions. It's most commonly used when dealing with clients, and it goes back and forth between the health professional and the client. Transliteration is the literal translation of every word being spoken. And this differs from interpretation, which looks at interpreting the meaning of the content being presented. Interpretation is the better option of the two, as you are trying to convey meaning across a different culture in situations where different semantics may be applicable to different cultures. To effectively use an interpreter in these settings, you must have an established interpreter. You need to check that their language and dialect is appropriate with your client. Try to schedule and book them in advance with all the required parties. Those parties would be yourself, the client, and the interpreter. Prepare the questions and information for discussion prior to the meeting, and clarify any areas of uncertainty in the mind of the interpreter. You must also introduce everyone when you all meet together to ensure that familiarization can occur and that the proceedings are explained in full to the client. You must also speak to and look at the client, not the interpreter, when this is occurring. Use small chunks of information that needs to be interpreted at a time, and observe the non-verbal reactions of the person carefully. And this will tell you a lot about how they are reacting to what you are saying. Ask questions in response to those non-verbal reactions, particularly if they look frightened or overly worried about something. You should also ask the client to summarize the information you have presented to demonstrate their understanding of that material and to ensure that the interpreter has correctly conveyed your meaning across to them. There are disadvantages to the use of family and other staff members who may be from the same culture or speak the language of the client or patient. These would be that the family and staff are not professional interpreters and they are not registered with the appropriate boards. They cannot ensure the accuracy of these interpretations. And you can't determine what they censor, misunderstand, or deliberately mistranslate to your client. Sometimes clients may not feel comfortable discussing sensitive information in front of people they know, and so a lot of information might get lost in this instance. There are advantages, however, to the use of family and other staff members. These would be that they are convenient in access and you don't have to avoid multiple bookings or rebookings with clients. And it also incorporates the family in the treatment when using a family member for interpretation. It's useful for much less sensitive, less important information that needs to be translated to the client. So let's look at some take-home messages from this topic. Culture can influence, but not necessarily predict how people think, feel, and behave. Cultural communication is more than just a language issue. And you need to be mindful of your client's cultural background and sensitivity when you are discussing certain topics with them. Health professionals need to behave with compassionate acceptance of all cultures and to be respectful and non-judgmental of all practices and behaviours being presented.